Ladies and gentlemen, welcome back. I'm trying to correct something that often, from the top of our minds, we make a mistake in, that we get obsessed with coverage in the north of India and don't figure out what's happening in the south. So I've spent a lot of time figuring out the details in Karnataka. So the border is now closed. Essential goods and services can move, but people can't use Karnataka as a transit point to get from Maharashtra to Kerala or otherwise. If you're carrying a Karnataka license plate and you have your ID card of your wherever residence is within Karnataka, you can come back home to that state. But if you're in Bengaluru, you are in lockdown orders, prohibitory orders. Everything is closed. Shops and malls will be closed, but grocery shops and milk shops and ATMs and bank machines and postal offices will all be open, but no public transport. So you will have to get a friend or a relative to drive you around. Public transport is closed. Now, that's Bengaluru. Let's perspective in Chennai. But before that, couple of quick details. I'm being now told that there are no prohibitory orders or a lockdown being planned for the state of Meghalaya. So we're going to double check on that information. And if anything changes on that note, we will keep on updating you. We're not going anywhere. We're here, right here with you through this because a lot of these measures are going to come in effect from midnight tonight. So we're going to see you through it. Because if any changes last minute, you're uploaded. So as of now, the information I'm getting from Meghalaya is that there are no prohibitory orders or lockdown there. If that changes at any point of time, we will inform you. Let me quickly get Ashwajit Singh into this conversation. Ashwajit, there is a very stark reality that is now dawning before us. And as I rope you into the conversation, let me just point out to our viewers who are watching this broadcast, and I'm going to do it in the easiest way possible. Just have a look at this. Now, here is where the issue begins in terms of what happens when panic grips us. Have a look at this. Now, this is in Germany, where the supermarket shelves have been emptied. This is Spain. This is Italy. This is Japan. This is France. New England. This is London. This is again London. This is in Canada. Now, we want to avoid these situations, but unfortunately, these situations have already been happening. Now, Ashwajit, what would you as a citizen, what information and succor would you expect from government at this point of time? You got the reassurances, but what would make you feel better and people around you so that they're not rushing off at the first chance they get to buy out everything the store has?
Rishabh, I think it's a very welcome and timely move by a number of states, including Delhi, to come in for a lockdown. In fact, it's very good that we've had that. While the Chief Minister of Delhi did speak about how he's trying to contain the disease, the virus, I think there are some related issues which also need to be addressed, if not immediately, maybe over the next couple of days. First of all is, I'd say two specific things that need to be addressed are, first is the medical preparedness that we have. Now, I understand in the coming week, the private testing is also going to start from the private laboratories. So I imagine that there'd be a huge jump of cases because as of now, India is definitely one of the more under-tested countries in the world. So I'm imagining that there would be a huge jump of cases. So it would be nice to know if how the government is going to be prepared for that. In my view, probably the government needs to get in the private sector even for the quarantine, getting some beds and wards earmarked for this disease. Perhaps it would be good to tie up with some hotels. Most hotels are empty, so you will need places to quarantine people. So probably you could look at hotels. Maybe army barracks is something you could look at. It's important to call back some of the retired medical health workers. It's important to train the Asha and the Anganwadi workers, the self-help groups, on how to tackle this disease. Because while the affluent will still be able to isolate themselves, the challenge is really where we are talking about the daily workers, where we are talking about laborers. So that's the first thing I would want some assurance on. He did mention about the supplies being available, but again, some kind of a reassurance, because I do imagine over the next couple of days, because we don't know how long this lockdown is going to be. So I do imagine over the next couple
sum
of
total
days,
what we're doing right versus what we need to be doing better. Now, what we are doing right is understanding very quickly of where all everybody else got it wrong. They waited too long. You heard it from Arvind Kejriwal, and the same applies across ministers, across governments, that once you wait for 1,000, 2,000, 3,000 cases, it's too late. The cat's out of the bag. So you can only do the lockdown when you only have 6 cases or 7 cases. If there are already 10,000 cases in India, this is irrelevant. We're all getting it one point of time, and the other is out of the bag. Then it's you're doing triage. Too late. So the lockdown has come very effectively, very, very quickly in terms of our curve. So that's what we've done right, because there's a realization, because if we end up in a situation like Italy and the UK, we're in soup. What we don't have, Ashwajit, are real numbers. I really don't know how many tests are available, how many tests have been done. I can tell you from research that we have about 70,000 ICU beds, but nobody has come and done this figure compared to the press conferences we are seeing in America right now, where I can tell you almost 2 million tests have already been performed, and they're doing them at 200,000 tests have been performed, and they're doing them at 50,000 a day now. We are missing accurate figures.
Absolutely right. So I think that's going to really unfurl over the next couple of weeks. The second thing is that while he did speak about private companies, continuing to employ their people, he did speak about government and other agencies continuing to employ their people. I'm a little concerned for the daily wages and the labor, because you did hear him say that the construction sites will be off. What happens to this labor the moment this is off? So I think you need to start looking at providing food packets, providing them some kind of a direct benefit transfer, some kind of a funding, some kind of a medical or food support. That's a very important thing.
Some of the states are looking at providing for 1 week these food packets. It's akin to us also, that if you can afford the food, and food is plentifully, there is no food shortage. I promise you, our office is next to the Okla Mandi. The Okla Mandi is jam-packed with food right now. It's just that the trucks have not been moving today, so the trucks are parked and they're full of food. So there is no food shortage. I've literally seen it with my own eyes coming this morning. A traffic jam outside because the parked trucks are full of food. So that's not the problem. The goods are going to keep on moving. So let me now rope in Mugilan, and then in immediate contrast rope in Narayan Tirupati, who's joining us from Chennai. Now Mugilan, in Tamil Nadu, what is the situation? Because we've been told 75 districts, the borders of Tamil Nadu have been sealed for the past 24 hours. What's the situation where you are right now?
Definitely, yes. Tamil Nadu has been under complete lockdown since morning, and all the borders are being sealed since Friday evening. Yesterday, there was a clear-cut order to all the district collectors to seal the districts, the bordering districts, and from yesterday morning, vehicles of other states are not allowed to enter or go out of the border. So, a stringent action has been taken by the Tamil Nadu state government, and what we're getting to here is now, as of now, Chennai, Erode and Kanjipuram are the 3 districts which will be kept under lockdown, is what we're getting to hear. But still we are waiting for an official confirmation from the state government, because as per our sources, what we're getting to hear is that the Tamil Nadu state government might add another 1 or 2 districts for lockdown, is what we're getting to hear. So as of now, 3 districts, that is Chennai, Erode and Kanjipuram, has been kept under lockdown.
Okay, what's
and
the
more
situation
importantly,
there in
today
Chennai?
being the Sunday and the lockdown, there were sense that the people there was a sense that this being a Sunday evening, that people might take buses to the districts where they work or where they wanted to go. But so to avoid the movement of people, now the government have extended the Janta curfew till 5 a.m. tomorrow. So now all the measures are being taken by the state government, and as I said earlier, we are waiting for an official confirmation, but as per our sources, what we're getting to hear is that all the essential goods and services will be available in the lockdown districts, is what we're getting as of now.
Sorry to interrupt you now. I'm going to put a pad on our screens for a second, just sort of visual reminder of what is taking place as we speak. this was the day today in terms of the curfew there. This is again sent by our own viewers. Dr. Nair Road in Chennai, empty. This is, and forgive my pronunciation will not be perfect, but Vadapalani in Chennai, as you can see, absolutely empty. This was before the clapping, so nobody out even in the balconies. This is Anna Nagar West. Have a look at the main highway there and the flyover. This was today, absolutely empty. Mugilavakkam in Chennai again. This is sent by one of our viewers of NewsX. No soul out on the streets. Virudunagar, again, everything locked down, closed. Marina Beach was officially closed today. Not a single soul there, minus few police officers. Coimbatore Junction, clearly. So this is what it looked like. Now, let me use the opportunity to quickly bring in now Mugilan once again before I come to Narayan. Mugilan, at this point of time, who are the officials of the Tamil Nadu government who are coming briefing the people about what is happening and what is currently the caseload? How many cases do we have in Chennai?
Definitely, yes. From the last 2 weeks, all the district collectors have been empowered to